Well, the news this week of the death of Luke Perry, Hollywood actor, at the age of 52 from a stroke, is certainly making people take notice of stroke once more, and why not? It is something that afflicts practically every segment of society. Dr. Michael Sauter is with us this morning from the Indiana Regional Medical Center, joining us by telephone to talk about this. Doctor, good morning.
Good morning.
It's good to have you with us here today. I would guess that a lot of people were shocked by the death of Luke Perry at the age of 52, but in the medical community, that's not really shocking news that someone would have a stroke so young, is it?
Well, the unfortunate reality is that stroke in the young, that is anything less than 55 years of age, is increasing in incidence in the United States. It encompasses about 20% of all strokes. So it's not negligible, and it's not that rare. The problem is that there is worsening overall health in the community, and that is with obesity and with the diabetes epidemic, and not related to him, but with the increase in abusive drugs like amphetamines and cocaine and heroin, which also play a role in producing strokes, and especially among younger people who would be involved with such.
Those are some factors that might have to do with an increase. But for someone who was as healthy as he seemed to be, someone who was in shape, and for really anybody, and it goes from really very young people all the way up through the entire age range, what are some of the factors, lifestyle factors, that would lead to someone having a stroke?
Well, especially in the young, you have to think about what has not yet been addressed in their life, and that would be, for the most part, diabetes, hyperlipidemia or high cholesterol, valvular heart disease that hadn't yet been identified since they were otherwise healthy and kind of fell below the radar, and hypertension. You know, we tend to still feel that we are impervious to health issues when we're all younger, but clearly that's not the case, and the subtle issues initially will then add up and accrue over time.
There are two types of stroke. Is one more prevalent among younger folks than the other?
Yes, the point you make is very good. There are ischemic strokes, which is blood clots, and there are hemorrhagic strokes. Now, in the older population, that is over 55, that ratio of ischemic strokes to bleeding strokes is about 85% to 15%. But in the younger population, that gets about 50 to 60% in the ischemic and 40 to 50% in the bleeding strokes. So there is a complete change between stroke in the young and stroke in the older populations.
Dr. Michael Sauter with us from the Indiana Regional Medical Center. We're talking about stroke, and particularly stroke with younger folks. Older population tends to be a population that is more prone to go to the doctor to get things checked out. Younger population, for a lot of, especially males, they think they're invincible and they don't need to do those sorts of things. In terms of monitoring, getting checkups, those sorts of things, what's a general guideline for a younger person? Overall health, the number one, but particularly someone who could be in that risk category for stroke.
Sure, there are really 5 guidelines. First of all, you've got to identify risk factors peculiar to that individual, and that would be diabetes, hypertension, valvular heart disease, high cholesterol. And then you've got to initiate a regular exercise regimen to improve cardiac fitness more than anything, and to help control or prevent the development of type 2 diabetes. You have to adjust your diets to include more fruits and vegetables and whole grains and less saturated fats and less red meat. And then you've got to prevent or control diabetes and hypertension. And then finally, you've got to avoid or reduce significantly the use of alcohol, tobacco, and any illicit drugs or excessive over-the-counter or prescription drugs.
Those predictor elements that come in with stroke that sometimes we see are much more easily identifiable in older folks. With younger folks, what are some of the predictors that doctors look for early in their life that makes them maybe perk their ears up a little bit more?
Well, sure. Especially in the young, that is less than 20, you really have to think about valvular heart disease or type 1 diabetes, or ill-defined high blood pressure issues, or what we call connective tissue diseases that might cause abnormalities of the carotid artery that supplies the front of the brain on both sides. In the young patients, this connective tissue disease can lead to poorly defined blood vessel walls of the carotid arteries that can then dissect or separate apart, causing turbulence, leading to blood flow abnormalities that ultimately lead to blood clotting in the brain.
And of course, when a stroke does occur, obviously that acronym FAST is more than just an acronym. It is something that requires your immediate attention, isn't it?
Yeah, it's very important because the same drug that helps with older patients who come in within the 3-hour window of symptom onset also pertains to the younger patient as well. That's the TPA, or the clot buster drug.
Yeah. So
really, the difference is what do you do after that acute intervention? And what you do after that acute intervention is you very aggressively look at the most likely causes of stroke in the younger population, and then likewise you look at the causes in the older generations.
Dr. Michael Sauter has been with us here this morning on Indiana in the Morning from the Indiana Regional Medical Center. We're talking about stroke. So all of that having been taken into account, do folks like you who deal with stroke patients, do you see an uptick in people wanting information and trying to get checked out when you have a famous person or someone who is close to them who suffers a stroke?
Well, it certainly becomes more in the mindset of older and younger people when a celebrity suffers an unexpected illness that affects him without obvious anticipation of this sort of condition. But what I have found over the last 20 to 25 years is that as people get older, they fear two diseases more than anything else. And one would be stroke, because they don't want to be a burden to their family members. And the other would be dementia or Alzheimer's disease, because they don't want to lose control of their ability to comprehend what's going on around them. So those are the two real important ones, especially as we advance in age, that people themselves fear.
Yeah. Hey, I want to thank you so much for spending some time with us. I know that you're an awfully busy guy, and you have helped to explain for us a stroke and again, the need for us to be vigilant, and both in terms of prevention and in terms of recovery. Thank you so much for being with us today.
Oh, you're welcome.
There's Michael Sauter, a doctor with the Indiana Regional Medical Center, talking about stroke here this morning on the Voice of Indiana County, WCCS, AM 1160 and 101.1 FM.